My name is Bruce Stevenson, and this is another one of our little videos about how to more effectively use Open Dental to make your practice administration easier, make your patient care better, and make your practice more profitable. In this video, I want to talk about using Open Dental images and letters both to improve your case acceptance and also in your marketing. I'll show you where you can download the Open Dental setup files when we get to the end of this video. To paraphrase Ben Franklin, if you tell me, I forget, but if you show me and give me a take-home picture, maybe I'll come back to have the treatment done. This, in a nutshell, is what we're going to talk about. If we go to the letters I've set up in Open Dental, there's several different templates. I'm going to show you the before and after. All I have to do is click on that, and it pulled those images in automatically. So this is very fast and easy to use. I can then either print it or email it or both. In this case, I'm going to email it, but I could also print a copy in the office for the patient. I click on that, boom, there I am. It's now in the email. I have another template up here that's the before and after template. I just click on Insert, and there's a little letter of congratulations. There is those photographs I showed you up there as an attachment. And down here I have links to Yelp, Google, and Facebook so people can write me a review. This actually works quite well. These images are stored in the image module in Open Dental. And as you can see, I got a whole bunch of different ones in there. And it's really easy to move these around. Down at the bottom, you see a before and after. And those are the images that I used in the letter I just showed you. So I can drag these different ones down to those particular image categories at the bottom. And now I have a different set of before and after images. When I go up and click on the letter again, right there, boom, different set of images. That's how easy it is. Just drag those images into wherever category, whatever category you want. You can see I have more categories down at the bottom rather than just before and after. I have image 1, image 2, and image 3. And I can take any images and drag them down there. Here's a Panorex. I'm going to put it in there. This is one of my favorite Panorexes for showing patients about what happens when you don't have your teeth cleaned often enough. So I can go in and now I can use a different letter template. This one's going to show 3 images. And there's that image up on top of the Panorex because I put it in the image 1 category. And I've got other images in there as well. So I can put a little note on here, remind patients this is what's going to happen to you if you don't come back to have your cleanings. I've used this Panorex for a million years with patients, and you've got to tell them this isn't you, but we don't want this to be you. So it's a really good example, I think, of periodontal disease that patients can readily understand. If you want to, you could just use that one image. Remember, that was in the image 1 category. So if I just click on this guy, now I just have 1 image in there instead of 3. I also have another letter that has just 2 images. So whatever images you want to show up, you just drag them down to the appropriate category on the bottom, and that's what you get. So I'm going to drag it back up to the top because I want to use this other Panorex that I also use a lot. I'm going to put that down there in image 1 to show what happens. Little cavities always get bigger. And again, now I just click on that, click on one image. I can write notes down at the bottom. Patients can understand this, and particularly when you give it to them as a walkout, it has an impact. Let's go look at another image here. Take a look at that crack on the buccal of that tooth. When you show that to the patient and say, listen, don't bite on anything till I see you next time, I think they're pretty motivated to come back. A picture really is worth 1,000 words. How about showing the patient the wear on their teeth? And if they can't see it on this image, I have another favorite one down here. How about that? And again, you want to tell them that's not you, but we don't want you to end up like this. I suggest you include clinical photographs as part of your initial patient exam. These are worth their weight in gold. And you can get paid for them. This is not just for ortho anymore. It has a 3-year frequency. Here's a little checklist to make sure your staff understands what kind of images you want. And I suggest you add this to your recall items every 3 years so it pops up automatically. Here's a nice inexpensive camera. It's only $800 for the camera and retractors and the whole shooting match there. The link to the camera is in the files. I'll show you how to download at the end of the video. So very fast and very easy. Simply drag and drop the images that you want into those image categories, and then go pick the letter that you want to show either 1, 2, or 3 of those different images. Really helpful for patient education. So paraphrasing Ben again, start using these really useful open dental templates and letters and images to enhance your patient engagement. That's a good term that we should be using. That really will help your marketing and your case acceptance. How do you get all the templates and images? Just go to our website, todaysdentalconsulting.com/letters, and there's a page devoted to the installation of these things. There's also a little setup video that you can watch. If you found this video useful, please give it a thumbs up. You might also want to subscribe to our channel and hit the little bell icon so you're notified when we have future videos. You can even share the video with your friends. Hopefully this video was useful. If you'd like any other help in using Open Dental to make your office more efficient and more profitable, please give us a call. That's what we do.